Remember? GFR. Zona glomerulosa, zona fasciculata, zona reticularis. From the first one, aldosterone, from the second one, cortisol, and from the last one, that's, I'm talking about the cortex, that's from the medulla. Yes, the sex androgens, and that's where you have less than 3%, they say. Some books, less than 5%. Because mostly we produce sex androgens from gonads, ovaries, testes. Okay? So make
what's
sure.
produced in the medulla?
Medulla, epinephrine and norepinephrine. Yeah. Epinephrine, norepinephrine, and don't forget, the medulla is not regulated by the pituitary gland. It just regulates the cortex. And who remember what hormone released from anterior lobe regulate the cortex of adrenal gland? ACTH, adrenocorticotropic hormone. Correct. So kind of like you know now, questions can be on these topics. All the blood cells, granulocytes, non-granulocytes, and their function, what they do to us. Hemoglobin structure. We talked about 2 alpha, 2 beta chains. Make sure to understand the structure and the heme and the iron in the center and its fate. So give me the fate of the heme. What happened to it? Because red blood cells, they don't live forever. 120 days and then deteriorate after that. So tell me what happened to the heme, what happened to the globin. Those are the main constituents of your red blood cells. Remember, globin, we recycle it. Heme, destroyed by intestinal enzymes, changed to biliverdin, then to bilirubin, and bilirubin will be changing in the stool to stercobilin and will be absorbed, some of it to the kidneys, and change into urobilin. Okay? Stercobilin, remember, in the stool, urobilin in the urine, from uro. Okay? Then globin recycled, because when I use it for future red blood cells, which are produced from very good, which is red bone marrow. So this is kind of like just to refresh your mind about things about hemoglobin. Blood grouping, we did experiment, make sure antigen, antibody, which one has no antigen, which one has no antibody, which one is universal recipient, which one universal donor, and to whom you can give and to whom you cannot give. So study those. And difference between whole blood and packed cells. Hemostasis process, I know some of you will write a paper on that, how we stop the bleeding and all the factors, clotting factors from the liver. We talked about all clotting factors, and we have 13 if you remember, but it's, if you count them, there are 12. One is missing, and we talked about this, but just go and review it. And cardiac cycle, all of you maybe remember that. And also don't forget the waves, because I can ask you a question. I'm not gonna ask you in heart attack, or no, that's not our topic. But I want you to understand what P wave is, what QRS is, and what T wave is. So make sure to read the question and answer our, it's a multiple choice anyway. Heart sounds, first and second, and their cause. These are very important. S1, S2, love and dub. EKG interpretation, that's the one we just said. Preload, after load, what, give examples on that, what can affect preload, which is the venous return that comes to the right atrium. This is important, just simply increase venous return when you exercise. That's simple. So more blood going to the right atrium and increase preload. After load, we said it's affected by any changes in the lining. So if you have a plaque, we call it atheromethous plaque, because of bad lipid profile that you have, it start to narrow the diameter. You deposit fat. That's what plaque is. Fat. And then you narrow the diameter, you develop hypertension. And if you leave hypertension, you develop what?
High blood pressure?
Hypertension is high, but what you can have if you,
Heart attack.
not heart attack can be any time.
Stroke.
Heart failure.
Yeah.
Because the heart is trying to pump and there is resistance. You see, you're narrowing it. You're opposing that force. So the heart will say enough is enough, and it fails, and the muscle gets bigger, and that's heart failure. You're gonna have edema in your lower limb. You're gonna have problem breathing. You walk just this distance, guys, and you start having dyspnea. So those are signs of heart failure. Fetal circulation is very important. Definitely you're gonna have questions on that. So make sure to know inside the womb versus after birth, what are the changes? Taking first breath, closing, forming a valve, okay, and becomes what? Because I'm gonna ask you, this becomes this. So if foramen ovale closes, what it becomes?
Fossa.
That's for example. PDA, remember? It was open, right? Patent ductus arteriosus. So they become ligamentum arteriosus. All right? So make sure to put those on a flash memory cards to review them, and all types of capillaries, including continuous capillaries, fenestrated capillaries, sinusoidal capillaries. Make sure to give example on each. Differences between artery and vein, and we went through it, summarize everything. Systemic and pulmonary circulation in general. So look at the pulmonary, make sure pulmonary artery comes from right ventricle, and it pumps non-oxygenated blood. And when it's oxygenated in the lung, it comes back as what? Pulmonary veins, 2 from each lung. So also go over this topic. Lymph circulation. Remember, difference between right lymphatic duct, left lymphatic duct, which we call thoracic duct. Which one drains more? Left thoracic, of course, left lymphatic duct, which is thoracic duct, drains about 3/4 of your lymph in your body. And make sure also to know when we drain the lymph from lower limbs, okay? It goes through lumbar with the intestine and trunk, because you have visceral organs here also, they have lymph, and they meet together all in the pool. You want to remember the name? Cisterna chyli. And I told you chyli means lymph in terminology. All right? So make sure to know that circulation of the lymph. B and T lymphocytes and subtypes, that's from the immune system, we went through it. Types of immunity, we just had it just before we came into this room. Active, passive, natural and artificial, you know, all these with examples. Adaptive and humoral, and what cells are responsible for each one. Difference between cardiac output, COP, and stroke volume. So what's your key here? Amount of blood pumped per beat is what?
COP. Cardiac
Stroke
output.
volume. Amount of blood pumped per minute, cardiac output. So simple difference between both. And hypertension and all types, of course, of hypertension. Difference between artery and vein. We list for you, oh, that's repetition?
Yeah,
It's repetition, I didn't know.
Yeah, it's number
Yeah.
12.
It's number 12. So we can skip that. Fetal circulation and congenital fetal heart abnormalities. We talked about them. ASD, VSD, remember?
Yes.
PDA,
Mhm.
yeah, all of those. Hormones affected by increase or decrease blood volume. We talked about when you have vomiting, diarrhea. Tell me what processes occur, physiological processes occur in your body and corrected. Remember, we went through it. If you eat too much pickle, yeah, during the day, too much salt, what happened in your body? Do you need aldosterone here? No. Because that's gonna retain sodium. I don't wanna retain it. I had pickles, during the whole day and excess sodium in my plasma and I want to get rid of it. So you have to tell me that aldosterone will be dropped in this case. Okay, we don't want. How about AMP? Do you need it here or you don't need it? Yes, because it flushes the sodium. Atrial, if you know the name of it, that's the answer. Atrial, it produced from the atrium, that hormone. Natriuretic, flush the sodium, because natrium is what? Sodium. Uretic, urine.
Urine.
It's flush it, of course, I need it here. Okay? So make sure to look at the table that I gave to you and, as a PowerPoint, and look at all the hormones that play factors in those conditions. Because we're talking about blood volume here and pressure. Changes of fetal circulation after birth, forming a valve, yeah, that's also needed. All types of immunoglobulins, today we went over them, the 5 IGs. Role of thyroid, parathyroid in regulated calcium, and I know one will write about this topic as a paper. So thyroid calcitonin, parathyroid PTH, parathyroid hormone, one bring the calcium up, one bring it down, balance it to 9 to 10.5 gram per deciliter. So shouldn't be a problem. Also the thyroid produced T3, T4, and we talked about the colloid. You saw colloid on the slide, the pink color inside, and that's how I can differentiate thyroid from parathyroid. Because remember we had it in one slide and we compared them. So your key is to look at the pink color in the center of the follicles, thyroid follicles. So definitely if I see it, I say, oh, this is the thyroid, this is colloid, which is thyroxine. That's what becomes thyroxine. Okay? So role of thyroid, parathyroid, and cells that producing it. So if I bring you a picture, for example, of that slide, and I point on the cells directly surrounding the colloid. What are those cells called? You forgot? That was the first slide that we looked at. Follicular, exactly. Because those are the ones produce thyroxine, which is the colloid. If I point on cells in between, parafollicular, and those that produce what? Calcitonin. Because that's how we drop the calcium, because of calcitonin. Okay? So make sure to look at those. Some of the diseases and condition, hyper versus hypo. Simple, because I brought you this question because we talked about hyper, hypo, and all signs and symptoms. Yeah, in general. Hashimoto's, we talked about it, which considered autoimmune. We talked about goiter. Yeah, the things that we just mentioned, just look at them. And then hormones from hypothalamus, which is the releasing and inhibiting hormones as well. And types of hypertension and classification. Okay, know the normal and stage 1, stage 2 hypertension, or pre-hypertension, where it's jumping from 90, they said, to 139, something, 80 to 89. They consider them pre-hypertension, so we have to pay attention. Then the moment it jumps in above that, they have stage 1. And of course, above 159 on top reading will be stage 2. So look at the classification. And then all adrenal gland hormones, the one I just mentioned, GFR, remember? Yeah, that's repetition from, and their function. So aldosterone retain sodium and what? Increase blood volume, increase blood pressure. Second layer, cortisol, which is regulate your blood pressure and your blood sugar level, and it's anti-inflammatory. when we have any kind of inflammation, naturally, when we have it, expect the cortisol will be released. And we need it because you know we have cortisone over the counter. That's synthetic. But you have it natural under the name of cortisol. We don't have cortisone. So when you buy cortisone, hydrocortisone over the counter, that's what synthetic. But you have natural called cortisol with the L. And this helps us when we develop inflammation. Because when you have dermatitis, for example, what you're gonna grab over the counter?
Cortisol.
Hydrocortisone.
Yeah.
Because you wanna reduce inflammation,
Itching.
you apply it on your skin. When I have tonsillitis, for example, sore throat, I expect cortisol will help me. That's my natural. So that's why one of the functions is anti-inflammatory. So regulating blood sugar level, regulating blood pressure, anti-inflammatory as well. It's very important. Excess of it is bad, and decrease of it is bad. So excess of it causes what? Yeah, what condition? Cushing. Decrease as JFK has that problem, which is decrease of what? Cortisol, hypofunction. What JFK had? Addison. Okay? And I think that's good with the 10 questions extra credit. And I want to see all A's now.
Okay.
I don't mind giving the whole class A's, you know, if they deserve it, you know, believe me. I'm ready to give all of you A, but prove it. Prove it, that's the whole thing.
Just give it to us. Some of us are visual learners. Some are like,
Visual.
some are auditory learners.
Yeah, but you're gonna see the test if you're
So
visual.
if you give me the test right now and look it over, I promise you'll get an
Because we review it.
A. No, you give me the test right now and you're like,
Yeah, but I'm sure, you know, I have students, believe me, they finished in 40 minutes, 45 minutes, and I'm sure they did good on that. No one can finish early unless they did good on that test. But again, read the question.
yes.
Now, diagrams, heart, I would look at the heart, coronaries, add it to you here. If, for example, you cannot see the diagram because it's black and white, you know, test is black and white. So come with a few diagrams, raise your hand, and I'll bring you the colored copy of them.
Oh, okay.
Oh, there's diagrams on
There's
this thing?
diagrams on it?
Maybe 3, the heart maybe looking at, you know, branches, because we said branches of coronaries is required here.
I think I'm gonna
So
follow up
you can look at the heart diagram, you can look at the thyroid, parathyroid, the one I just said. You know, it's not gonna be, we're talking 110 guys. If I say 4 diagrams out of the whole 110.
That's 4 questions.
Yeah.
4 points.
It's not gonna hurt you, you know. But again, I'm telling you, look at the heart diagram.
Okay.
Just quick, because you just did the quiz, it's not gonna be an issue. Yeah. All right?
Only the heart diagram that we need to look
The
at?
heart diagram, thyroid, parathyroid, something like that, you know, as far as layers of, did I put it for you here? Oh, differences between artery and vein, remember? The layers, write it down, layers of blood vessels, whether it's artery or vein, because that's part of the difference that we talk about. So look also at this, try, you know, your best. So we're gonna start the test in the morning, give you a break, come back, continue respiratory, and we may start a new chapter if we have time. If not,
Okay.
I'll just get you some of the slides.
And we can take the test in here.
Here, yeah,
That sounds good.
I'll see if they're not cleaning the room, but we have to ask them if they can open it. I'll let you guys come in.
That way we can just